Now it's my pleasure to introduce Dr. Ouellet for his speech. He was born in Longueuil, Quebec. He received his medical degree from Faculty of Medicine of University of Montreal in 1970. Now, between 1971 and 75, Dr. Ouellet trained at the University of Montreal, obtained his certificate of specialty in diagnostic radiology, and became a fellow of the Royal College of Physicians and Surgeons of Canada. He also trained later in ultrasound, CT scan, and MRI. Dr. Ouellet began practicing medicine in 1975 in the Mauricie region of Quebec, where he joined the Department of Radiology of Trois-Rivières Regional Medical Hospital and Sainte Marie Pavilion, and of St. Joseph Hospital in La Tuque. He later settled in Montreal area, where he worked in the radiology department of Cité de la Santé de Laval and La Fontaine Hospital in Montreal. In 1985, he was promoted to head of radiology department of Cité de la Santé de Laval. In 1987, recognizing the need for Laval area patients to benefit from cutting-edge radiology, meaning CT scans, and knowing that the Cité de la Santé would not be able to acquire CT scans for several years, Dr. Ouellet and few colleagues decided to launch and run Canada's first private CT scan clinic. In 1997, he opened Laval's first private MRI clinic as well. In 2000, he opened a second MRI clinic in Laval. In 2004, Dr. Ouellet became the director of two diagnostic radiology clinics, one in the Laval and the other in Terrebonne, which he transformed by bringing in cutting-edge digital radiological technology. That same year, he became an imagery consultant on the Laval Integrated Network Information System and served on a Canada Health Infoway Committee in an advisory capacity. His involvement with medical politics began in 2001 when he represented the Laval region of the Quebec Medical Association. After serving as treasurer and vice president, he became president of Quebec Medical Association in 2005 and served for 2 years. In 2003, Dr. Ouellet became a board member of the Canadian Medical Association and served on its committee on nominations and revisions. Dr. Ouellet is currently continuing his radiology and management work at the 5 clinics he runs and provides radiology services at the La Fontaine Hospital. He has worked in both the public and private sectors for close to 20 years. Dr. Ouellet is married to Diane Marceau and has 3 children, Maxime, Julie, and Sandra. Now it's my pleasure to introduce, I request Dr. Ouellet to come for his speech.
I have a script for this one. Yeah. Thank you very much, and good morning, everyone. It's a pleasure to be here. It's my 3rd time in Newfoundland. I was here previously as Quebec Medical Association president, but first time as president of CMA. And thank you for the opportunity to be here. I would like to begin today by commending the physicians of Newfoundland and Labrador and the NLMA for their work in supporting and working with the Cameron Commission inquiry. This process has, I'm sure, been very difficult for patients and physicians. However, the collaboration and openness of physicians concerning the inquiry was critical to Commission's work. I understand that the reports provides a blueprint for correcting many of the malfunctions in the system. Hopefully, the report's clear direction will be followed and the confidence of patients and physicians restored as a result. This year, the CMA is undertaking a major initiative aimed also at restoring confidence in our healthcare system. Based on the direction set by General Council delegates last year in Montreal, the CMA Boards of Directors has made transforming our healthcare system so that the system puts patients first a priority. Of course, you will tell me, it has always been a priority for individually as physicians. The excuses to not pursue this ambitious project are many, and believe me, I've heard them all. Look at the economy. We cannot afford this right now. Patients expect to wait. This is what we've always done. Why would we change? To the naysayers, I say, we cannot afford not to do this right now. Patients should not have to wait. They deserve far better. And for my response to those who argue for the status quo, remember what Einstein said. Problems cannot be solved by the same level of thinking that created them. A major part of the CMA's health care transformation effort is researching and learning about what is being done right here in Canada to improve patient care. And we also look at other healthcare delivery models used in Europe. Too often, good work and good ideas don't get the chance they deserve because of narrow-minded thinking or political unwillingness to act. Why is that? If something is working here in St. John's, it cannot be tried elsewhere in Canada. The answer, of course, is that new ideas can work in other places. We need more of that. When we, as physicians, talk about putting patients first, we are talking about building a true system of care. Right now, patients receive excellent care, but too often it is in spite of the system rather than because of it. CMA's fact-finding mission to examine the health system of 5 European countries, England, Denmark, Belgium, Netherlands, and France, showed we could be doing much more. These nations all share the common value of universality in healthcare, but also have made significant reforms on a system-wide basis with positive results. In short, these countries provide universal coverage with little or no wait times while spending less on healthcare as a percentage of GDP than in Canada. So it exists. We have always been told that if we want to have a universal system, we must have wait times. Or unless we don't have wait times, we'll go toward a US system. We have seen that it's possible to have a universal system without significant wait times because those countries, that's what they have. So why should we have that here? It's possible to have that here. And of course, the project that the CMA board has tackled this year cannot be carried out alone. We have sought inputs for as many sources as possible. It is critical to take in account the views of the membership, you know that, the views of the public, and other key stakeholders. We want this to be transparent, inclusive process that builds involvement. This is why we used Ipsos Reid to undertake comprehensive research that included a national public opinion survey, public dialogue session in Montreal and Toronto, and 5 regional focus groups. Our consultation also reached out to members across the country and received responses and input from over 2,200 members. The survey showed us there is a strong appetite for change in the system, a change that we would see greater access and greater accountability. It's not a word we hear very often, accountability. The consultation helped us arrive at 5 general directions, and I will talk about that. The first one, build a culture of patient-centered care. This means building a healthcare system that provides seamless access with no financial barriers to the continuation